So you're a new parent, and you've probably spent hours just staring at your new baby, noticing every single little detail. And maybe you've noticed a little spot, a patch of color on their skin. You're wondering, what is that? Is it okay? Well, today we're going to demystify the entire world of birthmarks. Right? It's the big question. You see a little mark and your mind starts racing. Is it a bruise? Is it a rash? Is it something I should be worried about? It's a question almost every parent asks, and we're going to break it all down for you, right here, right now. Okay, so let's get the official definition out of the way. A birthmark, which doctors call a nevus, is really just any area of skin that has a different color, and it's either there at birth or shows up pretty soon after. And here is the most important part, the thing I really want you to hear. It's nothing you did or didn't do. It's just a unique little part of how your baby's skin came together. Now, this whole topic might sound kind of complex, but believe it or not, it's actually super simple. You see, pretty much every single birthmark out there falls into one of two main families. And once you get these two categories, the rest of it just clicks into place. And here they are, the two big families. On one side, you've got vascular nevus. That's all about blood vessels that have bunched together. So think red, pink, or purple. On the other side, you've got pigmented nevus. And that's all about skin pigment, melanin. So think brown, black, or even bluish. That's it. It's either blood vessels or pigment. Simple as that. All right, let's dive into that first family, the vascular birthmarks, the red, pink, and purple ones. We're going to look at the three most common types, starting with the one you are absolutely most likely to see. First up is the one I'm sure you've heard of, the stork mark or stork bite. The old story was that this is where the stork carried the baby in its beak. The medical name, Nevus flammeus, is a little less cute, but that nickname tells you everything you need to know about how incredibly common it is.
And here is why that nickname is so perfect. Up to half of all babies are born with one. That's right, 50%. It's literally a coin toss. This is by far the most common birthmark there is. So if you spot one on your little one, know that you are in very, very good company.
So what do they look like? Well, they're just these flat, faint pink or reddish patches. You often see them on the back of the neck or maybe on the eyelids or nose. And here's the best part. In almost every case, they fade away all on their own in the first year or so. No fuss, no treatment needed. They just disappear. Okay, next up is the strawberry nevus, or what doctors call a hemangioma of infancy. Now, as you can probably guess from the name, this one looks a little different. It's a bright red raised mark that kind of looks like a tiny strawberry sitting on the skin. I love this because it shows you the whole life story of a strawberry mark. It can start out as this tiny little pinprick you might not even notice. Then in the first few weeks, it grows pretty fast. And I know that quick growth can feel a little alarming for parents, but it is totally 100% normal. Then, around 6 months, it starts to shrink back down, and by the time your child is 4 to 8 years old, it's usually gone completely. And our third and final vascular birthmark is the port wine stain. The medical name, capillary malformation, actually tells you exactly what it is. It's a patch of skin where the tiniest blood vessels, the capillaries, are just a little wider than they should be, giving it that classic purplish red color. Now these are way less common. We're talking about 1 in every 1,000 babies. So while you see stork marks all the time, port wine stains are definitely on the rarer side. So here's the really key difference with this one. Unlike the others we've talked about, port wine stains are permanent. They don't fade away, they'll grow right along with your child. But, and this is a big but, there's good news. Modern laser treatments can be incredibly effective at lightening the mark, especially when they're started early. Okay, so that's the red, pink, and purple family. We're done with those. Let's switch gears and move on to our second category, the pigmented birthmarks. These are the ones that get their color from melanin, the pigment in our skin. So, a pigmented nevus, what is that? Well, it's basically what you and I would just call a mole. Simple as that. It's a little spot where that melanin is concentrated, and it can be flat or raised and usually looks brown or black. Now check this out. Only about 1 in 100 kids is actually born with a mole. But here's the interesting part. While being born with one is less common, almost everyone develops moles as they grow up, usually after they turn 2. They're a totally normal part of having skin. So, just like port wine stains, moles are generally permanent, and they can change a bit over the years. Don't be surprised if one gets a little more raised or even sprouts a few hairs as your kid gets older. That's all totally normal. They are harmless, but they can be removed for cosmetic reasons if that's something you're thinking about. Okay, one last one in the pigmented family, And this one looks completely different from a mole. Let's talk about Mongolian blue spots. These are these flat, bluish-gray patches that, honestly, can really be mistaken for bruises. They're usually on the lower back or bottom, and you see them more often in babies with darker skin tones. But here's the key thing. Unlike a bruise, they are completely harmless, and they almost always fade away and become much less obvious by the time a child is about 2.
So, we've gone through all these different spots and patches. What's the big takeaway? What does this all mean for you as a parent? Well, the message, overwhelmingly, is actually really simple. Observe, but try not to worry.
If you remember only one single thing from this entire explainer, please let it be this. The vast, vast majority of birthmarks are just marks. They are unique little features on your child's skin that pose absolutely no risk to their health. Now that said, there are a few very specific, very rare times when it's a good idea to check in with a specialist. As you can see, you should give your doctor a call if a mark is especially large and on the face, if its location might get in the way of, say, their eyesight or breathing, or if it starts to bleed often all by itself. Those are the specific signs that just mean it's worth getting a professional opinion. So as we wrap this up, maybe let's look at that first question a little differently. Is that little spot something temporary to worry about? Or is it maybe just the first little detail in your child's completely unique story? For almost everyone, it's just a harmless little mark that makes them who they are. And honestly, that's a pretty beautiful thing.